This video is the art of hair transplant restoration surgery result with 1 year post-op with before and after photo by Dr. Diep and this Caucasian man who has frontal balding and the crown. We would attempt at least 2,500 grafts today. 2,000 grafts is in the front and 500 in the back. When we create the hairline, it's very important. We have to pay careful to a lot of meticulous detail because creating hairline is very unique, and when I create the hairline again, it's like a custom hairline because I base on each individual facial structure, and so the hairline for this client is different from his father, his brother, his mother, and everybody else. Why? Because each person's facial structure are different. As long as it's overall proportional to a third, from mid eyebrow to the hairline is a third, from the mid glabella tip to nose a third, tip to nose bottom chin is a third. On average, from the mid eyebrow to the hairline is around 7.5 to 8.5 centimeters for Caucasian, 6.5 to 7 for Asian or black. For this client, it's actually 7.25. And again, now, not everybody can fit exactly within the average. Again, because I'm only based on the anatomical landmark and the anatomy of the facial structure, and this is very proportional, at least for his facial structure. And then once we get the height down, and again, the more narrow the face, the more arch back the hairline, the more round the face, the more flat the hairline. So he's somewhere in the middle, so we arch back. Once we get the shape down, we're dancing up and down. And he had quite a bit of straggler hair here and there, down right where the tip would touch. So it kind of gives us a clue where the hairline was before too. So, and once we finalize the shape, and of course I do the measurement, I want to make sure the patient's happy with the height of the hairline and make sure it's even, semi-even. But if you split the face in half, no hairline height can be exactly even. And you split your face in half again, not every, the eyes and all this stuff on the cheek and all stuff is not going to be exactly identical. So then the hairline, as long as it's almost even, that's good enough. But you don't want to be too high and too low where it looks abnormal. So once we get a shape down, we transplant a very precise angle at 35, 45 in the front. Increases when you go backward and changes when you go different direction. We transplant rows and rows single hair graft in the front, which cause selection of hair graft. Transplant rows and rows single hair graft in the front to make the hairline look softer, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The goal in the back is volume and density, and that's why we transplant larger roots. The goal in the front is softness and naturalness without much harsh detectability, and we transplant rows and rows single hair graft in the front. So he have a medium fine hair. So there's good and bad with that. The more fine the hair, the more natural the look is. But the downside is that you need more hair to cover the same area versus the root that have thicker hair, because the root of thicker hair has appear better coverage, better density. But in actuality, the number of grafts will grow, but just the hair is a little bit thinner. But the good part is it's very soft and natural and without much detectability. I mean, we can always do another touch-up to fill it in. But my goal is trying to dense pack as much as we can and put it and do it one time, so without having to come back. Again, hair transplant not a perfect science. Sometimes you might need more than one surgery to have perfect density. I'm very excited about him because his look will completely change. And so this is a 2,000 up to 2,500, and 2,000 front and 500 in the back for a hair transplant on a Caucasian man using the FUE method. And then hopefully we'll get a chance to do an 8-year follow-up. Thank you.